In this episode of Veteran Salute Stories, I'm with Dr. Tyler Williams with Better Sleep. So, Dr. Williams, every veteran, or for that matter, everybody needs better sleep, but veterans have kind of a different set of issues. There was a recent study that I heard that the military did about sleep apnea. You want to tell me about that?
Yeah, so when troops are deployed, they often are going to areas where they don't have a lot of electronic availability or access, right? So they can't plug in their CPAP if they're wearing a CPAP. So this study was on an oral appliance, how effective it was with deployed troops, right? And generally, if someone's having less than 10 episodes per hour, that would be like 10 gasps, 10 snores, we would say their sleep apnea is managed pretty well. And this study, they were able to get almost 90%, it was about 88% people under 5 episodes per hour, which is really the gold standard.
Wow.
So,
no electricity.
No electricity.
Just this device.
Just plain old, analog still works in today's day and age.
Wow. So you also treat a lot of veterans. What kind of troubles do veterans usually, because they're usually a little older and such, but what kind of issues do they have to be careful about?
So, in the military, I've worked with several dentists and doctors who are ex-military, and it's gotten better, but it used to be that if a tooth was even maybe going to be the slightest hint of a problem, you would take it out, because if he or she was deployed and then it became infected, they may have to get sent home. And so some of these veterans are maybe missing half their teeth or more just from experiences when they were soldiers seeing the dentist on staff. And so with that losing teeth, our mouth will shrink, and the smaller our mouth gets, the more our tongue doesn't have room to go. And so it can block our airway easier when we lie back, which would cause an apnea or a sleep disturbance.
So it sounds like this device could help a lot of veterans get better sleep.
Yeah, absolutely, because it's helping their jaw stay in a position that allows them to breathe more naturally when they're asleep, rather than just letting their tongue and jaw fall back.
Okay, and what's this device called again?
We call it an oral appliance. There's different, or a mandibular advancement device, but mostly we call them oral appliances, because in the old days, 20, 30 years ago when they first came out, people thought about it as pulling your jaw forward, your bottom jaw, right? Okay. And that could cause some jaw pain and discomfort. So now we're just keeping people's jaw in a more natural position. And we actually do a snoring screener for people, where we put their jaw in different positions with this system we have, and we can kind of tune their snoring, and we can hear how loud it is and where to quiet. And then when we find that quieter spot, that's where we design their appliance to kind of find the sweet spot, like tuning a car.
Well, if there's veterans out there right now saying, geez, I want this, or maybe their wives are, how do they get a hold of you?
So 801-901-8990 is our main number. You can call or text. Our website's bettersleepslc.com. We have some books, some different magazines, handouts for patients. And for our veterans, it's nice because Medicare, TRICARE, medical insurance covers these devices, which can help out a lot of our veterans.
Very cool.
Yeah.
With another episode of Veteran Salute Stories with Dr. Tyler Williams, I'm Doug Jessop. We'll be right back.